Where does the belief come from that green snot equals bacteria?
It's driven into us as some sort of kids. Everyone's fascinated with the green mucus that comes out during respiratory events of childhood, which are almost always viral. So few of them actually have any
So
bacterial
how
origin.
do you convince people that green, yellow snots...
We just have to educate them. We have to sort of say that the green mucus is just myeloperoxidase. It's a heme pigment that breaks down from the enzyme that's in white cells, and white cells are released, and it's released.
So it's actually high in iron.
Yeah, so
being really
and
snotty is
all these are released
not good for your immune system.
when you have a viral event, and you only have to ask a person who has really good going allergic rhinitis how many boxes of tissues they can fill, and there's absolutely nothing wrong with their sinuses. And so you can see where that misconception comes from. They think that just because they're producing a lot of green mucus and they don't normally, that therefore they must have something more than simply just a rhinitis reaction. But that's all that most of them actually have.
And so how do you explain that to patients, Richard?
It's very hard because some patients we try to educate not to use antibiotics when they have these events. We talk to them about triggers. We talk to those patients about using intranasal corticosteroids episodically, so starting on them when they start to feel that sense of congestion. And then occasionally, at my level, at tertiary level, we even have to bring some of those patients in and assess them during their sort of flare-up to almost show to them that what's going on is not a sinus infection and to stop seeking antibiotics for it.
And how would you assess them
And
at
you know
that
what?
visit?
So in a recent study we published, we actually took patients very formally and did a camera investigation in their nose, an endoscopy, which you can just do sitting in a chair. And we actually performed a low-dose radiography of the sinus cavity. It's called a cone beam study. And it showed that more than 96% of patients who came in absolutely convinced, right at the very pinnacle of all these patients who get recurrent rhinitis symptoms, that 96% of them didn't have sinus disease. They all had rhinitis, even though the patient belief was so strong that there was something more going on than just rhinitis.
It sounds so much more severe and
they want
sexy,
it to be.
dare I say. They want it to be sinusitis. That's a hell of a lot worse than allergic rhinitis, particularly if you call it hay fever. Sinusitis.
It does
that's really,
trivialise it, yeah.
That's really a severe problem, an infection. They're convinced it's an infection. So they happily come back from the GP with some antibiotics and say, look, I've got sinusitis, and that's why I've got all these antibiotics. And they take them for weeks and weeks and weeks, and they're probably not much better.
Yeah, many you hear that all the time. Many patients say, I had to take 3 courses of antibiotics, and then finally the 3rd course worked. And I think, well, the 3rd course worked because eventually your viral-induced inflammation just resolved on its own.
Yeah. Oh, look, I think, as we were saying before, Richard, I think GPs are very well aware of shepherding, the judicious use of antibiotics, but the antibiotic guidelines would suggest that you prescribed antibiotics for sinusitis if you had more than 7 to 10 days of a triad of symptoms of pain not relieved by decongestants, pain referred to a tooth, mucopurulent sputums, in fact, one of those triads. So
and the thing is that often things like unilateral symptoms are sort of missed, a lot of the time. Because unilateral symptoms, I think, really imply something more than rhinitis, and that's the time to sort of consider antibiotic therapy. And we talk about that, how many days into an event. So there was a study on children down in Melbourne that looked at when their parents took them to the doctor to have further treatments. And this is really good for John, for being a pharmacist. They took them to the doctor when they had enough of the green mucus. They had to go and see their doctor. It wasn't day 7 or 10, it was day 3 and 4.
Yes.